I'm Paul Kelly. I'm here at the Temple Human Performance, and I'm going to show you a little mobility routine that I've created with our mobility strap, our Physiokinetix mobility strap. And we made it really soft and silky so that it doesn't hurt your skin. You can wrap it around your body parts and your limbs and do some different mobility routines and nerve glides. And it really runs really well with a lot of the nerve glides that we teach with the treating trapped nerves and myoskeletal. Okay, so I'm here again. I'm going to show you a little foot routine that I do. You can do these different ways. Obviously, there's different parts of the ankle to work, the soleus, the deep calf muscle, or also the gastroc. They do work different areas. So when I do this, I want to take the strap and wrap it twice around my foot. I just want to put this out there for the Physiokinetix people out there, people that are in our seminars that haven't seen it, to learn. So if you got your leg bent, this is working more soleus, deep, and you're getting more exposure to the soleus. And it's nice, use your loops on here and just grab them tight. And you're doing graded exposure, so you're actively moving the foot as you pull, obviously, in a rainbow. Try to work the ankle in inversion, eversion, and then do the midfoot. Try to get that midfoot, right around that first metatarsal. A lot of times I'm telling people to get in here and put their fingers under here and push those down. Notice how we want to put that curve back in that transverse arch. Push up into it and put that arch back in. And that'll help those hammer toes if you're experiencing those hammer toes. I tell a lot of people also about the bunion in the foot. Take your fingers in between your own toe and put your thumb against that metatarsal, the medial part of that first met. You want to put your thumb right up against it and start working on inverting that toe. Just push a little pressure, and you can put your other thumb in there too and work right off this cuneiform. So your first metatarsal where the cuneiform comes in, and then I've got my fingers hooked in with my thumb lateral on the side. And really, this is a powerful way as you're doing your mobility routine with your foot to start putting curve back in your arches. You need to have these springs in the foot. They need to work. So we want to see this foot working really nice, and that inchworm effect that we talk about in our video series in the Art of Mat. How does that foot inchworm? Can it come together here? Can you get these plantar fascia, the intrinsic muscles to work? So the mobility is really important. Work that mobility first with your strap. Here's another way, one more for you. Now straighten out your leg. I don't usually do this seated because I don't like to flatten out my low back. So I don't really suggest you sitting in this position for too long, flattening out the lordosis of your low back, because you're going to create some low back problems. So just go ahead and lay down when you do this. And you can wrap your strap twice again if you like. I always like to keep it wrapped twice. What's nice about our straps is they move really nicely, and they don't hurt your foot if you're doing it barefoot, which is super nice. And they also work as tree straps, so you can use your routine outside and use the bands on the trees. So now I'm going to do a straight leg. If I'm doing it straight, I'm thinking more gastroc. I'm thinking the deep nerves of the leg, all nerves of the leg really. And so we're going to be pulling in a rainbow out here. Now I'm really going to feel this a lot more because it's going to tug on that sciatic. It's really going to tug on the distal branches. I can feel it. And so working that circle, light tugs. I might get a 2-second pull. Working on a lot of runners. And if you're a runner or if you're just standing on your feet, people think that stand-up desks are the greatest thing ever, and they're not. They're not. It's in gravity, and most people are leaning forward at their head. It doesn't matter your ergonomics on these desks, and yes, they should be up taller and higher, but it still doesn't matter. If you're leaning in your forefeet and you're working standing up, you're still in that same inhibitory reflex that causes all these postural problems. Do some circles. I always want to do some circles with my foot in both directions if you can. You'll find that one direction will be harder. And just get that ankle loose in the morning. Try those routines. Get down here with your feet and start working them too every day, especially if you're a runner, if you're on your feet a lot. Like I am as a therapist, don't neglect your feet. These are the first communicators to our brain. So I hope that helped you a little bit on learning some mobility and using our strap.